start.
Okay, maybe because I am not a co-host.
Okay, I think we can go ahead and get started.
Okay. Okay, great. Thank you guys for all coming. I think we have, how many people here? 26 participants, which is great. I wasn't sure how the research panel would be attended. I wasn't sure if people were just going to run over to the caregiving and the clinician people, but I'm very happy to be amongst our research people. Let me just go ahead and start by, I actually want to say that I really have enjoyed the beginning of this conference. I feel like there's so much of this that even though we're virtual, that so much of this is about sort of connection and community. So I sort of welcome everybody to sort of take a little time in introducing yourselves, talking about, you know, your background and your work as we get started. And so I'll go ahead and start. People can be on the camera or not be on the camera. The panelists, you know, it's nice for us to see all of you, of course. Okay, so my name is Liza King, and my pronouns are she, her. I work at the New York City Health Department, where I've been there for 20 years. And I am Chinese, born and raised in California. But I've been in New York City for like 20 years. And I think I come from a place where I feel a little bit nervous about working on a research panel because I do not work really very directly with research as maybe many of you do. I don't work for an academic institution. I've published very few papers. I've definitely worked on some non-peer-reviewed work. I wrote a report about the health of Asian AAPI New Yorkers. And that's sort of what's led to sort of wanting to continue this work in AAPI, youth and mental health, as well as just AAPI health in general. But I do a lot of work in sort of looking at very large population-based data and trying to synthesize it about New York City. And in that space, I always feel that, you know, it's so hard to really understand what's going on with AAPI mental health. And when you look at this really big data, you know, it's not disaggregated enough. It's not intersectional enough. It doesn't really show, I think, so many of the problems that or not problems, but just concerns that we see in our communities with AAPI youth, and how we can better, you know, work with those communities to improve and to actually address the needs of these populations. So a lot of this, you know, the building of this panel, I know that so many of you work in more refined spaces about AAPI youth and mental health and the research there. And so I'm so interested to know more about that work, as well as talk more largely about decolonization in that work. So that's me. And I know that Sana has introduced herself already, but you can continue to introduce yourself, Sana, if that's okay.
I also just wanted to, I summarized the keynote, and Dr. Jacob Palm's keynote, if to summarize in 2 words, would be love and presence. And so I just want us to start out with those two words, even for the research panel today. I'm an assistant professor at the NYU School of Medicine, and I do a lot of mental health work among Asian Americans. Really happy to be here.
And I guess let's start with Tara. You're the first one in my box.
Absolutely. Hi, everyone. My name is Tara. My pronouns are she, her, hers. I am currently a sociology PhD student at UMass Boston. And I am also a research assistant at the Institute for Asian American Studies here at UMass Boston. Right now, we're working on a mental health project. It's kind of twofold in terms of a quantitative analysis of the collaborative multiracial post-election survey and looking at with Asian Americans in order to kind of get a wider approach to what those patterns look like in terms of different ethnic groups. And then like the second part of that project is looking at focus groups with Asian American college students, especially those who are heavily involved in their campuses, because we see that a lot of the times people say that like being active or being participating in activities tends to mitigate factors of like depression or anxiety. And yet we still see that being really prevalent in a lot of Asian Americans that are still like heavily involved and active, and trying to see like why that is, why that isn't necessarily a mediating or mitigating factor for a lot of Asian Americans. And just like my own personal experiences, like as an Asian American, I'm Chinese and Vietnamese. I was born in Boston and lived here my whole life. And really using my own positionality to push forward our research and push forward the ways that we think about AAPI mental health.
Thank you, Tara. Your audio is going in and out. Even when it's out, it's still audible, but not as quite. I don't know if there's something. Yeah, thank you.
It got a little better at the end, I think.
Good. Yeah.
Yeah. Sorry about
that's okay. Go ahead, Liza.
Oh, okay. Let's go next to Andy.
Okay. Hi, everyone. My name is Andy. I'm out in California, as Liza was saying, and pronouns are he, his. I'm multiracial, cisgender man, Japanese, Portuguese, and I was raised in rural Hawaii. So that has really kind of animated the way and the perspectives which I bring to Asian American Pacific Islander research. I guess if we're talking about positionality, I have that as the question. I guess I really mostly, Liza, it's funny you talked about, not feeling like a researcher. I actually think that researchers don't know a lot except just how to do certain things. So I mostly just approach all the work I do as like a vehicle for doing the research that is decided on or agreed upon by the communities that I work with or the partners that I have. And I just bring kind of expertise on, how do you play the game? How do you write a paper? How do you get the data? And then I don't really have much decision-making power, I think, intentionally after that, except it's just like a support role. So yeah, so maybe I'm very dismissive of kind of the role. Research is important, but academia, yeah, it's kind of a mixed bag. So that's a little about me, I guess.
Great, thanks. And let's go to Crystal.
Hi, everyone. My name is Crystal. I'm also in Boston, so Tara, we should connect. I am a child and adolescent and adult psychiatrist. I graduated from my training last year from Baltimore, and I've been in Boston and Cambridge actually for about a year now. And I work part-time at the Harvard University kind of like student counseling center, where I see a lot more AAPI clientele than I normally have in kind of like psychiatric treatment settings. And I also have a part-time private practice where I primarily do therapy with AAPI teens and young adults. And I would agree, I wouldn't personally define myself as kind of like researcher in the way I feel like the connotation is of like doing kind of like a lot of intensive academic research with number crunching and stuff like that. But I do a lot of API related work, which I really appreciate what you said, Andy, of just like challenging the idea of like what counts as like research and what counts like doesn't, and how do we define like the value of like data and information and knowledge and what we consider to be research to move the needle forward of our understanding. So I love that. And some of the specific work that I do is I've been running kind of like for 2 years when I was in Baltimore, I ran kind of like community Asian affinity groups. And I continue that specifically at Harvard right now. I'm also involved in the Mass General Cross-Cultural Center for Student and Emotional Wellness. That is a program that's really aimed at a community level, like providing kind of like information and like psychoeducation and support for Asian youth mental health. Part of that, we're working on, for example, like an online toolkit targeted at Chinese, specifically Chinese immigrant parents, to provide them with some like framework and information on like mental distress and resilience, and talking about these concepts like mental health and how to connect with their children better, packaged in a way that hopefully they are able to kind of like understand, that's like culturally informed, and sneaking in some anti-oppression work there, which can be challenging depending on kind of like their past experiences and stuff like that. And I'm also involved in our consortium program, which basically provides kind of like lectures and case consultations to schools in the nation that have majority international Asian students boarding at their school, and helping them better support those students. And so those are some of like the stuff that I work on.
Okay, awesome. Okay, and then finally, Medha.
Hi all, my name is Medha. My pronouns are they, she, identify as a non-binary femme person of Bengali descent. My family is from both parts of Bangladesh and West Bengal, and I was born and raised in the Philadelphia area. I currently live in occupied Lenape-Hoking land, which is also known as New York City. I'm kind of coming from a different background where I have a lot of research experience. I have an MPH, done a lot of mental health research and other types of public health research in an academic space. But I currently work at Coalition for Asian American Children and Families, where I'm their senior policy coordinator for health. What has brought me to work in this space is actually getting really just frustrated being in the academic space. I think, Andy, you really spoke to a lot of what I kind of experienced in the academic spaces around research, and feeling like a lot of work was being done for the community, but it doesn't actually intentionally include community perspective and voices, and just, you know, their ability to participate as equals in the research. And so, and there's a lot of, I think, struggles with feeling like I was working in this kind of like almost factory of like, we got to just churn out studies, papers, go to conferences, speak on it, but actually not seeing the real impact in our communities. And so in my current role, I have a bit more ability to do like community research. And while we partner with different institutions, right now, what I'm really trying to focus on is how do we actually have a more holistic understanding of mental health for the API community. I think that we have a lot of focus on individualized like talk therapy and medication, which are important, but we have to acknowledge when we talk about decolonizing, really the systems level thinking around, we come from a lot of collective communities. we need more collective healing. A lot of times the type of care we see is kind of a band-aid to our issues. And so we really kind of are trying to focus on how do we move away from just this narrative that there's a lot of stigma in the API community around mental health by addressing why does that stigma even exist, and understanding that there is such a lack of linguistic accessible, culture responsive care, also care that has been in our communities for centuries, indigenous knowledge that we should also be uplifting in the mental health care space. And so that's really where I'm focused on. We also, some of the work I do is addressing kind of the carceral lens in which our mental health care works. So happy to speak on some of this later. Thank you.
Okay, great. Thank you all so much for your introductions. And I think I like that we can all agree that we are not academicians, in that sort of sense, and that we can sort of have this we can kind of start with our talk about decolonization there, in the way that we sort of decolonize, where we come from academically and how we maybe have fought against what academia means to us, what does decolonizing mental health mean to you in your research? And I guess I'll start with Tara, if you can, we can kind of go in the same order if that works for people, or if people want to speak up, just raise your hand.
Yeah. Is my microphone a little bit better now? Okay.
Yes.
Let me know if it goes in and out again, because I tried to stop the Zoom's automatic background noise thing. But yeah, what decolonizing mental health means to me, it really just means that we center AAPI voices. I think that's at the forefront of the issue, and I think a lot of the panelists, and Liza, you as well, have touched upon this, and this idea that academia, research, and even mental health techniques and things like that, those are really centered around Western ideas and these ideas that don't necessarily align with a lot of AAPI youth and a lot of AAPI adults as well. I think it really just means that we need to be more community based. We need to be centered on activating, on highlighting, on emphasizing AAPI voices, and making sure that they're at the center of or we are at the center of what that means and what we need in terms of our mental health, rather than focusing on these Western ideals or the very Americanized or Eurocentric ideas of what that means and what research is as well. I'll stop blabbering on.
Do you think, and I'm kind of interested in this, because I do see that, centering AAPI in so many ways and working with those communities might mean definitely that AAPI are the ones who are really doing the research too, because they sort of understand their communities. Do you feel that it really needs to be done by AAPI identified people,
That is a really great question, and something that I've actually posed in my methodology classes before as well. I do think that, at least to some degree, I do feel like for me personally, I think that a lot of the API research should be led by APIs, just because we have that personal connection to the research, to the topic, to experiencing it personally on a personal level. I think that is such a just important factor when it comes to research, and having that intimate knowledge of what it means to be an AAPI identifying person. Those are things that you just cannot get if you do not identify as API. But at the same time, there is merit to having an outsider lens as well, because sometimes we can be too entrenched in our identities and we can be too entrenched in our own experiences that it sometimes can cloud that judgment of what I'm looking at. We see it as common sense, but from an outside perspective, it might not necessarily be common sense. It might not necessarily be something that is normal, that we've normalized, but it might not be necessarily normal. And so I think there's merit to both, if that makes sense.
Yeah. Would any of the other panelists want to comment on that?
I think I would agree that there's definitely, when you are personally invested in a community and a cause, there is like a special kind of experience that might lend itself to like your investment in that. And at the same time, I feel like so much of our racialized position in society as AAPI has been segregated and like isolated from other communities of color, and especially for those who are multiracial or multicultural, all of these constructs do not fit nicely for everyone to be like, this is who I am, and the other. And I feel like part of my work that I'm trying to move forward into is kind of more coalition building and like interracial solidarity. And when we talk about community, it is not limited to just our racial community. It is our collective community and collective struggle as marginalized peoples, not even just racialized, but like the intersectional component of all of the complex ways that our identities interact with each other. So I think that I'd ultimately probably lean towards no, actually, that like research and work on AAPI should be limited to AAPIs doing it, because I don't think that is going to be what liberation looks like, because liberation is collective. There's no liberation if not everyone is being liberated. And so I think that's something that I haven't seen done very much with Asian AAPI communities. And I think that's actually a really important direction to move in.
I'll just jump in. I really appreciate what you said, Crystal. I fully agree with that. I think, the goal here, like, I think a lot of times, I think recently we see decolonizing come up, and it's not just an intellectual pursuit, and it is also like a long, it's bloody, it is a very much, you have to be out of your comfort zone. And so it really means challenging the way we even understand, like, what is AAPI identity? What is when you even think about marginalized, like within the AAPI community, who are the most marginalized? How do we uplift and center those voices? And think about, like you were saying, how our oppressions are all interconnected. I wanted to actually just briefly quote this really wonderful South Asian poet and screenwriter Fatima Asghar, who recently wrote such a great thing about decolonization. She was saying how decolonization is not an intellectual enterprise, but a spiritual one. It challenges us to detangle our programming, to learn from our ancestors and the things that they regret and struggled with or have shame around, to transmute into fuel for creating the world that we hope to live in. An embodied relationship towards decolonization is what allows it to actually move things out and through our body, out and through our ancestry and our family line. It means working with somatic practices to allow our bodies to show up differently in the world and to really work to bridge the disconnect that can exist between the mind and body. So I think that's like a really powerful way of even thinking about challenging how we even understand what is mental health care, and how much of it is focused on just like, our in the West, we're really centered around detaching mind and body. It's like we've focused on them separately, but how much of it they are so connected, and we need to have like a bodily approach to this work as well.
Yeah, let me actually, so I wasn't probably going to say anything, but because I think I echo everything everyone was saying, but something you said, Medha, is really kind of ringing, which is really what drives some of what I do, at least kind of in this like traditional research space, is that kind of why are we centering these perspectives in research? And ultimately, I think the discussion that it tends to happen not really well in academia is the idea that research and you prioritize and center communities and perspectives and interests to kind of equalize power and, improve justice, honestly. And that's not a word that I think it's thrown around quite enough when it comes to especially mental health research and interventions. One of the things that I think I'm really challenged by is the fact that so much of mental health is centered on the person as opposed to not just the community. And I think one of the things that, at least for my work, decolonizing mental health means is spotlighting things like oppression, stigma, prejudice, and kind of these structural inequities. I'm a clinical psychologist, but now I'm in public health, and public health does a much better job of talking these things through and thinking more of structures, racism, things like that, and how do they perpetuate kind of mental health and physical health disparities. And my big issue with that is so much of mental health systems, interventions, and I developed some of these, is that it puts the onus on the oppressed to fix kind of the problems caused by the oppressors. And that's where I think, Krista, you were talking about like liberation, things like that. But the other thing I would add, and this is what Medha just spurred me to think about, is I do talk a lot about mind and body, but when I work with Asian American, a lot of Native Hawaiian Pacific Islanders, there's the spirit aspect that isn't talked about nearly enough, and I think is foundational to mental health and well-being for indigenous communities, colonized communities, that is just completely extracted from mental health in like this Western perspective. And I think that's probably one of the big missed kind of entire blocks of just the Asian American Pacific Islander experience that I don't think we're addressing at all, really, on a foundational level, except kind of more on the grassroots or kind of in clergy and churches and things like that. Yeah.
Thank you, Andy. I'm like thinking about how we can better address our spiritual selves, you know, like what kind of, in research, how do we make that happen? And I also really like that quote, Medha. I want to share that with the entire group, like later on somewhere.
Share. Yeah, I can share. It's like from a I think a form, like a Substack or something, so I can send the link.
Yeah, I think the word disentangle really like resonated with me, because I think when I think about decolonization, it is really like everything you know is not, you know, like everything that with the structures and systems around you were not built for you. How do we re-envision that? How do we disentangle who we are, you know, outside of that? And it's not like living completely separate from that. We still have to live within the systems and structures, but like how we recognize that like it's not working for us. Okay, so I'm gonna keep going with some of these questions and think through how maybe you guys could speak a little bit about how you've worked to use sort of a decolonizing lens in some of the research that you do. And maybe I'll start with Medha first.
Sure. Yeah, I think kind of touching on what I started with of like, you know, what we're centering is like holistic mental health. I would say that's like a large part of the approach. And, you know, again, I wouldn't say I'm necessarily doing research right now, because I am more so looking through a policy perspective and bringing together like different community voices to amplify some of our policy recommendations. But one thing that we are doing is working on an asset mapping where we are trying to collect the information of a lot of our CBOs that are, without realizing, embodying holistic mental health, because they may have clinical mental health services, but they also have a food pantry. They also have a senior center where they bring together, you know, the AAPI senior population to do things like have a cultural night and watch a film that makes them feel more connected to each other and be able to be in community with folks, right? So I think that the way that trying to approach decolonizing, you know, I almost feel wary of saying that of exactly what I'm doing, because I think it is such a lifelong process. But the steps we're trying to take is really trying to center the fact that in our cultures, in our histories, there is so much types of care that we actually have what should be considered mental health, but do not get to be called mental health. And we should be able to embrace those and be able to have access to those. I think a lot of times what we see is now there's this like uprising, like wellness culture in the West. And who does that usually serve? It's wealthy, tends to be white folks. Like there's all this like yoga, hot yoga, and acupuncture, and these things that, you know, should be available to those who come from the cultures that brought that to here. And so I would say a lot of what the work we're trying to do is how do we make that more accessible to our communities, and also just change the narrative around what is considered mental health, and addressing, I think, again, going back to the thing of like we focus so much on you know, mainstream talking about API mental health ends up being focusing on stigma. And I think really trying to, that really ends up putting the burden on our communities. It's like, oh, you need to do the work to heal because of all these things that have happened because on the hands of oppressors. And so I think really when it comes to collective healing and collective understanding, it is to really push the needle around our mainstream understandings of mental health within our communities. I hope that kind of addressed the question.
Oh, it does. It does. Yeah, I think also I agree with you, sort of like the spaces outside of what we consider traditional mental health spaces are so much of where we can find the healing that we need. Now, in some ways now more than ever, like looking through, defining our communities, redefining sort of like what our community is that supports us. And so I feel the same way about that. Crystal, do you have any thoughts on that?
Yeah, no, I definitely agree with everything that was brought up before. I have also been really thinking about like the decentralization of mental health treatment and like really thinking about what are the core aspects of what in theory mental health treatment as we know it means. Like what are the goals, and if the goals are to be like happy and healthy and at peace and like feeling safe, like there's no reason why all of those things can't be done completely outside of like a Western treatment, psychiatric or like therapy based kind of setting. And like how do we achieve those goals and like go try to facilitate that healing process and the mental health and wellness component in the spaces that we are forced to feel divorced from through colonization and like Western like hyper individualist capitalist values. And I think that I really agree with that sentiment of going back to community. And then when we think about research, then what are like the data gathering tools that we can use to kind of navigate this fine line about how to be justified enough in the systems we're forced to be in and still not feel, like enslaved essentially by the oppressive like frameworks that it necessitates, and have some balance of a liberation and decolonized sense and intentionality. Andy, I think before you were saying about how you identify as a role of like a supporter of centering these communities and helping them play the game and kind of like figuring out how to straddle this position we're in of trying to reject colonized frameworks, but still being forced to play the game, for all of the structural reasons. And so that's kind of what I think about of how to enact like decolonization in both research and in treatment of how do we define research and knowledge gathering and like figuring like out details of problems and like learning all this knowledge to fix them outside of the definitions of like the decolonization, the colonial structures we are taught, and how do we define these things for ourselves outside of the white gaze, and how do we seek healing and all of these goals in theory mental health treatment is to do through community and like relearning the erased histories that we are not taught, and how all of that is as valid and as important, arguably more important than like the westernized kind of framework of what like illness and treatment is.
Yeah, I completely agree. And I think I sort of think about this when I think about, we do these very large sort of population-based surveys where, we can ask questions like, have you ever been diagnosed with depression? And then there, which is very clinical and which is very, like some people that has not happened for, even if they are depressed. And then additionally, but we try to find these other questions like, do you have anybody that you can turn to in case of an emergency, that might really get to, the like lack of support that some people have, and where do we find that question? In what spaces, like if you have not sought clinical mental health treatment, or like what we would maybe say in the Western space is mental health treatment, but you need mental health treatment, or that you go somewhere else, how come that doesn't get counted in the data? You know, how come that you don't get counted as somebody who needs support, you know? That's something I think about. I don't know if Andy, you want to talk a little more about this?
Sure. Really, this is a great panel because I get to think about and hear perspectives that that I think about, but aren't really surrounding me in kind of a really academic space. For decolonizing, I'm trying to figure out what to say because I kind of want to address the idea of a game, actually, which isn't quite what the question was. But so, Crystal, yeah, you were saying, and I was saying that there is a game. And what's interesting about this is I was thinking we can talk about with funding and research, but there is a game that you kind of have to play when it comes to research. There's these research methods, there's what's accepted, things like that. And also in the mental health system, there's a very specific way that things have to go. There's a referral, there's insurance, you kind of have to play the game in the system. But I think we all recognize, and maybe we're all frustrated, I'm hearing, that research, the structures are super limiting. They're restrictive, right? It's why I think I'm kind of dismissive of research. And I'm really impressed when I hear like the journey of Medha, because I kind of did the opposite thing, right? I was a clinician, didn't care about research, and then eventually went into research after I was kind of practicing for a while, because I said, maybe there's a different way to do it. And I know other people focus on the research and then realize, wow, this is limiting, I can do more, right? I can affect real change. And that's, I think, the thing that is the challenge is how do you bridge the fact that research doesn't really accomplish anything when it comes to real impact or change. And that's where, at least for me, it's working with communities, because it's more communities, grassroots power. We've been hearing a lot of liberation, policy changes, things that actually will functionally change the system and the structures. And then, at least for me, in my perspective, I can just arm communities with it. And it really is mostly just working with communities and this is the decolonizing lens I guess I do adopt, is communities will tell me what their research priority and interests are. My job is to kind of respond to it, figure out how to like package it in a way that is kind of the game, and then realize that I have no power after that to do anything because I'm just producing data, and then hope that the communities can then take this and do what kind of hopefully someone like Medha is doing, shape policies using the data. And yeah, and I think that's really my biggest challenge, is recognizing that it is such a game, and everyone I mentor, I try and talk to them that is a game, and there are rules, and then hopefully, we can work with people who can kind of break out of that. Thing. Yeah, don't really have a coherent thing about that. Yeah, sorry.
I think we're all being coherent enough. Medha, sorry, did you want to say something?
I just want to respond to Andy. I appreciate what you said, but I also want you to know that I feel the same way in my position, because policy change is so slow. You can have a million people rise up and say that they want something, and it might not change, without getting too direct. But I think that the reality is, since I really resonate with that, and I think one thing I've been really trying to center is the fact that understand the limits in what we can do in our workspace, and trying to put some of that time and energy to organize outside of that, really being able to be in community with folks who feel the same with you and cannot maybe feel limited in their workspace, to find those spaces to, there are so many amazing AAPI, like grassroots groups that are really trying to shift the needle in our thinking and trying to get our folks together and have a more collective understanding of these things. So there are ways, and I know I think it feels it can feel very limited because we're all working in the system that itself is it comes from a very, if you think about even just the mental health system, the thinking comes from a very colonial imperialist way of thinking, even up to recently, the DSM-5 made it seem like trans people, people who are trans, that's like a mental illness. Like PTSD doesn't even fully acknowledge people who are living through current traumas. And so these terms can be very limiting because it comes from such a small group of people's experiences of mental health. So I want to encourage all folks to feel like, that there are ways, and we have to kind of do that work and chip at it from all different sides. So yeah.
I just wanted to just reiterate everything that everyone has said. It's kind of crazy to just like be surrounded by so many people that have share these thoughts and share these feelings, and it's like very empowering and very like makes my heart feel very like full. But I just wanted to add, I think Liza, you said something that kind of like stuck out to me, and it's like when asking like APIs, like, oh, like, were you clinically diagnosed with depression, yes or no? Like that doesn't really like gather enough of the data of like, just because you don't have a clinical diagnosis doesn't mean that you're not depressed. It doesn't mean that you don't have mental illness or that you don't need help. And so like when I see like the CDC has Asian Americans at 3% of the population has depression or anxiety or mental health problems, and they're the lowest like racial group that has like mental health problems. I'm like, how are you operationalizing that? How are you defining like what mental health is? And something that one of my supervisors has talked to me about is the ways in which we see mental health issues kind of arising in Asian Americans in terms of their symptoms. And maybe it's, oh, like I can't sleep at night. Like I only get like 3 hours of sleep per night, or I have chronic migraines or chronic headaches and things like that. Like there are different ways in which mental health issues surface for like AAPIs, and using that language and decolonizing that language and really understanding that there are different ways in which depression, anxiety, any kind of mental health problem presents itself in AAPIs. Like that is so important for us to acknowledge when we talk about decolonization. It's so important when we talk about the language that we're using, or the types of like symptoms that we're using to diagnose people. And that's such a like, and I don't know, that's such a silly term in my head, just because I'm just like, like people's feelings are valid, people's feelings are real, whether or not they have a clinical diagnosis or not. I don't know where I was going with that, but you guys just like reignited like some sparks in me.
Dr. I think you wanted to speak up. Did I see you wanting to say something, Chang?
Yes, sure. I guess, after hearing so much about it, I guess I just have a little bit, sort of some thoughts and based on my own experience to share, and maybe I'll sort of introduce myself a little bit. So I'm an assistant professor working at Columbia University Medical Center. So sort of very similarly, right, in the sort of very academic institution. And then I also have a sort of wear two hats, right? One is researcher. I'm also a clinical psychologist by training, and having a clinical practice on my own, doing clinical work there, right? And then to me, I guess it's interesting to hear everybody talking about all this sort of, the concept of decolonization, right? And to me, I think the first step is to be able to recognize what's called, colonization. See, similar to Jacob, right? I, couldn't even say this word right because it's such a new term, right? But so I often share sort of the first thing I share about sort of, what I do is I'm sort of my expertise is in the evidence-based treatments for child and mental health, right? And just sort of, what I have to say in itself, my training in itself, right? Already, sort of has a lot of colonization in itself, right? And so I think for me, right, the first step is to recognize, right, sort of structurally, systematically, where are all these places, sort of, that we encounter, and sort of, it has become in some ways, right, the part of our own self-identity, right? And then as we advance in our own work, then how do we sort of, a sort of, break from that, right? And interestingly, sort of, I don't know if you guys know, right? So where I work, Columbia, is also the birthplace of DSMs, right? And sort of there's a long history to that, right? And then I'm also, trained to do CBT, right? Which sort of back in the days when I first started, right? That was, yeah, like you guys said, right? It's sort of, gold standard, right? But I think I would appreciate also the fact that as I sort of, work, through over the years, right? And I think that this is also the process of acculturation that then, you bring part of yourself into the work you do, right? And that in itself is decolonization, because you change the work that you are doing, right? And then so I think, I've sort of, my work has spanned, from policy. I was also working at the DOHMH for a while, right? And I think there's sort of, a need to for the integration, right, of policy, treatment, right, or intervention, or clinical work, right, as well as research. Right. And then how do we do that? And I guess I'm now avoiding asking the question how, right? But it's really, I think, exactly what we're doing here, right? Bit by bit, right? All of us as individual coming in collectively. And this sort of really is the, you guys is sort of, organization to sort of, being able to make a little bit of change every step of the way, and to, hopefully make it for the better.
Thank you. Thank you for that. I know, I think when I think about, maybe I think about this in my own identity and my journey, which is that like, when you see so much, when you start learning so much about the history of AAPI and where we come from, and then, how there was just no research done on our communities and the mental health of our communities at all until very recently, but that's starting. People are actually recognizing that like, oh, Asians have mental health issues, like we need to address this, but I feel like it's just starting. Like it's just sort of starting to really build a body of work. And it's sort of in the same way that we kind of think about decolonization, like this conference, this is the first time this steering committee has come together to put this conference together to really think about what does decolonization even mean for our community. And I have this vision that in a year from now, when we meet again, we'll have that more solidified, and then we're going to be more like, okay, now where are we going from here, because we're just starting to really have these conversations. And I think that we are bringing it all to our work, and it's really exciting, but it's like we're all still really new to it too. And we're all still trying to figure out what it means. So I really appreciate that comment. And I'm going to be sort of vaguely mindful of time. I believe we have about 20 minutes left, which is still plenty of time. But I do want to talk a little bit, because we've sort of acknowledged how the research, I sort of appreciated, Andy's comment about like how limited we are with research, how when we publish stuff, does that move the needle at all? Are we accomplishing anything? And so I would love to hear a little bit more from our panelists about like, just like, where would you like to see research going, and how would you like to see it working for us better?
I'm so sorry. Mark, did you raise your hand? Did you want to speak?
Oh yeah, but if the panelists want to go first, I can go at the end. I just had some like articulations for you guys.
I don't want to interrupt the flow, but I also want to be participatory. So
okay.
would love for you to go, Mark.
Sure. Okay, so thanks everyone for your work. So just a brief introduction. So my name is Mark Byan. I currently work at AAPI Community Health Center. We are a primary care facility, well, fairly qualified health center, but it started off in response to like the HIV epidemic, right? I'm very accustomed to like being in spaces where we're not allowed to talk about things, right? So you can't talk about sexual health, and you can't talk about mental health. And I was in between those spaces constantly, where I understand from an institutional perspective, dealing with one stigma at a time is hard enough. And then dealing with 2 or 3 on top of that is almost impossible. So I really appreciate being in this kind of space. I just want to articulate some things. So I was introduced to this term. I'm going to look at my notes too, because I had to write this term, pracademic. I learned like 2 months ago. So I met someone who works in cybersecurity, focusing on PHI, personal health information. And they're saying like they do teach, but they're very policy oriented and they have to be on the front line of what's like going on in cybersecurity, right? So they are a pracademic, so practical academic, or some of you know the term praxis. So maybe that's a more suitable term for you guys, right? In terms of research, I think it's kind of like the law, right? In some ways, you have the letter of the law and then you have the spirit of the law. And so you have this literature in front of you, but you're constantly debating like, well, what am I supposed to do with it? What is the spirit of it? And in terms of like playing the game, I think you can play two games at the same time. So there's the institutional game of like getting your funding, but then there's like a more personal game. And what I mean by that is like, I'm also kind of in this world of being between science and art, where sometimes I think science knows more than art. And other times, art definitely knows more than science. They know something intuitively, they feel it in their bones, but science just doesn't have the tools to like provide that evidence which will get you the funding. So I think you can stay in touch with both, and that's okay. In terms of the work, I've been struggling with this for a decade. If you think about the term mental health, the connotation of it is, you know, what do you think of? That person has gone mental. This problem is about your mentality, which you know, you're shifting the agency to the person, right? It's you have to change it. What I tell people now is that because it's so complex, it's like, okay, what's the most complex organ in your body? That's your brain, as far as I know. If anyone has any evidence to negate that, please let me know. And so your brain deserves levels of complexity in terms of care, in terms of anthropology. It's not going to be like, you know, addressed in one swoop. And that's just what I tell people, because like it gets too hard to like go through all the things. So if that's a useful metaphor for you, then please use it. And then the last thing is, I wonder if any of you, like, if you guys in your practice or research, you talk about the city structure itself. Like, I live in New York City and I just feel like I'm not human sometimes because we're just living on top of each other. And this produces its own set of mental health issues, right? I feel like we kind of maybe take it for granted now. Like the city is a hard place to live, but urbanization is becoming a kind of like a normalized pattern throughout the world. So I'll leave it at that, but thank you everyone for your work.
Is it cool if I jump in? I just, yeah, I really appreciate what Mark just said. And I wanted to kind of tie it also to the question of like, where do you see like research going to really address decolonization? And what you were saying at the end of like, just even thinking about the city, I think really ties into it. You know, one thing we have to realize is that the way that our diagnosis, our understanding of mental health is very much centered on our ability to be productive in the society. It is centered around our ability to work and show up every day. That's where a lot of these diagnoses even come from. It's like, oh, are you feeling, you know, down? Can you get up and go and work for the day? And I think that a lot of the research needs to start focusing on how this system, I mean, not that that's already happening, but I think even more needs to be addressing the system as to what allows these kinds of you know, illnesses to manifest. And I think that this comes down to like in New York City, it's like, I think working in the public health space, it's like really hard to like center like one issue, because it's like housing, it's like just food security, economic security, all of these are so intertwined. And you know, like really what decolonization is going to look like is like we have to work away from this capitalist system that we are in that is literally killing us. You know, I'm forgetting the person whose quote this is. I'll look it up, but I'm sure you've heard this one. You know, it's like, how can you be, it is odd to be like healthy in a sick society. Like we are all, you know, navigating illness because we are constantly navigating so much oppression and witnessing so much oppression as we walk out at the street. You know, we are kind of conditioned to normalize the violence of like seeing how houseless folks have to live and how just people around globally are being oppressed because of a lot of times of the policies of our own countries. And so, and what even leads to migration patterns, right? So I think that like I would love to just see more of like addressing the system and how do we make the system accountable, instead of kind of a lot of times what happens is more individualized individualized perspectives in the research of just like, oh, this one community is experiencing these, but why? So yeah.
Yeah, actually, you just reminded me, I forgot to mention one quick thing. I'm also on my journey, like, it's such complicated questions. I think what might help our community is actually people's personal stories. I know I'm saying something that's very obvious, right? Duh, right? But the stigma level is so high. A lot of us are like going through that coming out process, or if you're queer, it's like a second coming out process, and there's so much silence. But once you see someone's story and their life, you're like, oh, you don't fit so neatly into these categories, and that's why we do the work that we do. So, I actually have a list of people like Asian descent who I've actually told their stories because it is building, right? But it hasn't gone to that climax yet. But I think we're slowly getting there. And Medha, am I saying you're right? Medha, thank you for your
Almost, yeah, Medha, thank you so much.
Oh, Medha, I'm sorry. Thank you for your comments.
Yeah, I just wanted to add to this. Thank you, Medha, and thank you, Mark, for sharing so much insight. I feel like in terms of decolonization, like for me, kind of just like being entrenched in like the research world, I think that a lot of researchers tend to like this idea or this narrative of being objective. And objectivity is really just looking at everything from the gaze of a white man, like heteronormative, cisgender white male lens. And I think we do need to step away from that. And Mark, I know that you're like, well, duh, like we should be highlighting people's like stories and experiences, but it's not a duh moment for researchers, like for us, maybe that's like, yes, absolutely, we should be highlighting people's stories. Absolutely, we should be like listening and trying to learn and understand everyone's histories and experiences and get that deep, profound knowledge of like what people's own like experiences are. Uh, but that's not the norm for a lot of researchers. I feel like although we try to like stray away from saying like quantitative data is the best data and stuff like that, at the end of the day, that's what's most valued in academia and that's what's most valued in research in general. Those are the ones that I see in the canon, and those are the ones that I see in my classrooms. Is like the things that are valued are the things that are quote unquote objective and quantitative. Whereas you can't quantify the stories and experiences that people have. You can't quantify my mom's refugee story and her experiences with oppression, with colonization, with poverty, with all of these different interconnected, complex parts of her identity and parts of her history. And so it's important for us to highlight those stories. It's important for us to decolonize through storytelling, through using qualitative work, and through really emphasizing and highlighting the stories of people's lived experiences, rather than the numbers.
Awesome. Thank you, Tara.
Crystal or Andy, would either of you like to add to the comment?
Yeah, I completely agree with that. I think that yeah, the fact that lived experiences should be as valid as considered like empirical data from primary sources is a perfect example of, I think, decolonizing research and decolonizing our definitions on what is scientific data and what is objective data and what I personally don't think there's any such thing as objective data or like a neutral stance. We are always operating from a system of bias and histories of bias and frameworks that were created by humans and subjectivities. And so I think that all of this just makes me think about just fundamentally like how we went back to talking about like what even is the definition of research and like acceptable research and like valuable data or like valuable interventions and like what counts as data gathering and what counts as analysis that's like respected in academic and research communities. And it's part of decolonizing for me is like Chang Ying said, really kind of critically thinking about what are we taught in our training of what is valid science and how much of that is just colonized sources of definition and knowledge, and how do we just reject that as the only ways to think about knowledge and research, and how do we define for ourselves what makes sense for us in our communities. And that goes towards like definitions of diagnosis of pathology and suffering, what appropriate interventions there are for pathology and suffering, and what types of measurements we can define for ourselves of how we know if things are getting better. Like I saw a comment about something about like the PHQ-9 and like the GAD-4 and stuff being more utilized. And I think it's always good that more discourse is happening about our communities, but my instinct is actually to be quite concerned and rejecting of that, because the screening tools are very Eurocentric, westernized screening tools. The types of symptoms that are in these checklists are very limited to kind of like Western Eurocentric frameworks of what is anxiety and what is depression. And especially as we talk about before of like the separation and exploitation of our histories of like collectiveness and like holistic balance, in my mind immediately I'm like, what are screening tools that if we made them for ourselves, what questions would they have? I don't think it would look like the PHQ-9 and GAD-4. I think it could very well include way more like the spirituality component of like, how connected are you feeling spiritually? How isolated are you feeling? And why, you know, like how are you feeling excluded and like not belonging, and why? And it's like that and why part that I think we've also talked about of so much of the data is like, who meets all these criteria for mental suffering right now? And there isn't the why part. And I feel like that's the part where decolonization comes in that is so important, because there's all of these structural reasons of why that we don't talk about. And it's, I think that for me is like a huge component of decolonization and rejecting the frameworks that we're taught to think.
Yeah, I like that. I'll weigh in really quickly. I actually like how well-formed everybody's responses are. Mark, it blows me away because my answers are probably not going to be that well-formed. But what's funny about it is kind of tying into some things that I've been hearing really quickly to answer kind of Liza's question. If there are really two things that pop for me in general when it comes to research. The first is that context matters. And so that came up with urbanicity, but it also comes up with culture and cultural context. So I do a lot of work around cultural context because I have recently started to kind of put into my papers this concept that I believe culture is foundational to kind of human health, well-being, and survival, but we just don't recognize how important it is. One of my colleagues that presented to them, and he was a big sociologist at Columbia for a long time, he said, culture sounds the way I was presenting, like water to a fish. You know, you take somebody out of their culture and then they'll flop around and die. And that's what he kind of said. And I think that's truly true. And I integrate that into something that I'm talking about a lot more now, which is cultural trauma. I saw historical trauma come up. And that's something I think we really should be starting to think about is, I think communities know this. I think it comes up in all my conversations, but we don't do research on it. We don't really define it properly. And I think that's kind of a missing gap, especially for Asian American Pacific Islanders. Like, what has colonization done? How has, you know, historical traumas or even conventional traumas, immigration issues, you know, conversations that are happening now, how is that really harming communities? And the second one is actually, I have this whole concept that communities and people have the solution. That's kind of I give talks around that. And that has led me to what Mark was saying, which is I truly believe now when we're trying to message to communities that it is all about storytelling and narratives. And I talk about that all the time now. Is I feel like my work now is more health communication than mental health because storytelling narrative is how we've learned for millennia. It's how we understand the world and it's how we can convince people or educate people or outreach to people. It is stories and narratives more than brochures, booklets, anything I learned that as a manualized treatment. And so I really like that it's just kind of organically coming up because, like, again, the community has taken me in so many directions. And now I'm a true believer in context and narratives. And that's not something as a clinical psychologist I ever learned kind of in my program. Yeah, this has been kind of a post-training kind of journey with communities, yeah, to educate me. Yeah.
And your answer was very well formed.
Yes, I would also agree. And I also, I agree with you that narrative and storytelling is a really powerful way to communicate. And like, I also, you know, because I work in a lot of health communications to large audiences, thinking about how you message that. But I guess the health department, we're always trying to do that with data. Like how do we provide some data, but like frame it around a context or a narrative that would resonate with people? And I think there is that's like that sort of component that, like, you know, we could all tell stories and we can just make documentaries, or, you know, which would be really cool. But I would also want to see some kind of research and data component weaved into, you know, like some of what we are talking to communities as well. And I think it's hard, you know, like thinking about how you would do that. And I think if I'm going to have one last question here, and we really only have 5 minutes, so just, you know, anybody who has any thoughts on this, it would be a little bit about how we share our research, you know, and like what do you envision sort of maybe being the best way to bring the information that we have to the communities that need it? And anyone can start.
I can go. I do think that there really does need to be more intentional connecting with community members. And that means, like, of course, you can connect with CBOs, but really being able to, like what I was saying earlier, is like, yes, we have to be doing the work both in our waged labor work, and then also outside of that, how do we connect with our folks and really be able to talk to them in a way where we're sitting on the eye to eye as just two people who really want to learn and encourage to have more understanding around this, right? And I think that you know, CACF has partnered with NYU many times, which I'm really grateful for, to put out a lot of more intentional studies and work. And so one thing that was important for that was that from the beginning of the study is we are tied in. We are from the beginning. We are sitting with them. We are in all of them having conversations around what will be the approach for the survey or the interviews, focus groups, and actually getting to have a say in that a lot more. I also want to encourage, just because, you know, this kind of like final thoughts, you know, folks to really read decolonial thinkers. I want to uplift Frantz Fanon's work, who is an Afro-Caribbean psychiatrist and political thinker who has given us so much. You know, what is it? Black Skin, White Mask is one of his most famous books. Also, Gabor Mate is another great person in this subject. There's also a great book called Crazy Like Us by Ethan Waters that actually talks about the kind of transporting of the Western ways of mental health to the rest of the world. So I really encourage people to like use that kind of thinking to help them in informing their research and putting it out.
We got a 2-minute warning for the Zoom. I wish we had more time. I love this conversation, and I really love learning about each of your work. Any kind of closing thoughts? The Zoom thing is so awkward. It like closes you off, right? It takes you back. We're
It
like,
is.
no.
We're just gonna disappear and go back to the big room.
Yeah.
So.
But I appreciate all of your time so much. Wish this discussion itself was more participatory, and that's on me and Liza. Yeah, yeah, I don't want us to like awkwardly shut us off. So I just want to thank all the panelists so much, as well as participants and Liza for facilitating. And we hope that this conversation continues.
Yeah.
Yeah.
Thank you, everyone.
Thank you, everyone.
Thank you all so much.
Yeah. And hopefully no one minds if I reach out to them on the panel. Yeah. Continue the conversation. I've learned a lot. Yeah. Thank you.
Yeah. Okay. See you all on the other side.